The opinions of the individuals during this broadcast are their own and may not be the opinions of their group or other organizations they may be involved with.
You're listening to the Pace Radio Network here at paceradio.net.
I'm looking at myself, reflections of my mind. It's just the kind of day to leave myself behind. So gently swaying through the fairyland of love. If you'll just come with me, you'll see the beauty of Tuesday evening news. Tuesday evening
Hello, everyone, and welcome to today's live edition of the Psychedelic Reporters. For today, this Tuesday, December the 7th in 2021, here on the Pace Radio Network, the very first video podcast focused on psychedelic medicine being reported in mainstream media. Tonight, I'd like to do a special shout out to the guys in Dead Ringer from Kirkland Lake. We debuted our very first time playing our own music, created and performed by Dead Ringer. Of course, originally recorded by the Moody Blues, the score by the Moody Blues, originally entitled Tuesday Afternoon. We tweaked it up, made some changes. Tuesday evening news it is from Dead Ringer. Shout out to the boys in Dead Ringer from Kirkland Lake. Bunch of miners.
Great job,
out
guys.
there.
Yeah, great job. Like, I mean, yeah. I just gotta say thank you. And it, I'm the more I listen to it, the more I'm in love with it.
Yeah, it's very cool. They did a fantastic job with it. I really liked the original tune. I wanted to make some changes, and I went on the hunt for a band that could help me out. Worked with a couple of different musicians. Dead Ringer came through with flying colors. The minor boys, man, they know what they're doing, but with the instruments too. Absolutely. So yeah, a big shout out to the boys from Dead Ringer in Kirkland Lake. It's been a busy week in cannabis news, and Bufo's been in the house this week, hasn't he, Cindy?
Absolutely. Bufo Alverius sits on our shoulders and tosses stories at us every week. I'm sorry, I'm playing with something in my hands and I keep looking down. I'm going to stop doing that. And just so you know, Bufo Alverius, what Bufo is he is the psychedelic toad. He's otherwise known as the Colorado mudslinger that you found. I've only ever known him as Bufo. So Kim taught me that he is also known as the Colorado mudslinger. Bufo, by the way, just so you know, he secretes the DMT, like the actual DMT frog medicine. When he is scared, you go boo, and he kind of secretes all that wonderful stuff that helps us heal. Really, So he's absolutely fantastic, and he goes and he finds these stories, and he comes back and he tells Kim and I, and we bring them to you fine folks.
Yes, we do, and we're going to get started with our first 5 stories coming at you from good old Bufo, whispering in our ears. And our very first one coming at us today is the first. It's a look back actually in history. We're going to look back at like how we got started. About a year ago, we started investigating psychedelic news and what's going on in mainstream media with psychedelic news. And this was one of the first stories that caught my eye. It's 1 year old, so I thought, well, let's bring that back for an anniversary look at it. The first ever DMT clinical trial for major depression was about to begin. Now, this was in the UK this time last year.
And of course, DMT is Bufo doing his absolutely amazing work. Researchers in the UK have just received the go-ahead a year ago, just received the go-ahead to begin the first ever patient clinical trial using we're just going to call it DMT, widely regarded as one of the most potent psychedelic compounds on the planet, often referred to as the spirit molecule. DMT is known to produce an intense visionary trip into the deepest reaches of human consciousness and will now be studied as a potential treatment for major depression.
Yeah. I mean, very, very cool stuff. Use of psychedelics to alleviate depression and other mental illnesses is something that has gained great deal of support within the scientific community over the years. Most notable, of course, psilocybin, psychoactive ingredient in magic mushrooms, has been found to be significantly ease depression. And speaking of easing depression, it's 7:10 East Coast, so Havtokana. Yeah, so I mean, tryptamine, psilocybin belongs to the same broad family as DMT. Both compounds are acting on the brain's serotonin receptors in order to trigger altered states of consciousness. DMT occurs naturally in many plants and animals and is most associated with the Amazonian drink ayahuasca as well as the frog, which has been used ceremoniously for centuries as a treatment for physical and mental as well as spiritual ailments.
Yeah, it's a fantastic medicine. I mean, absolutely fantastic. Previous studies have indicated that a single serving of ayahuasca generates lasting changes in brain function, causing rigid patterns of connectivity to become more malleable. Such changes were accompanied by an increase in cognitive flexibility, indicating that DMT may enable people suffering from depression to alter their thought patterns. While the acute effects of ayahuasca can last from 4 to 8 hours, smoked or intravenous DMT tends to produce a very short yet extremely powerful psychedelic trip. It lasts about 15 minutes, generally lasting 15 to 30 minutes. A recent survey conducted by researchers from Johns Hopkins University indicated that 90% of the people who have tried DMT report greater life satisfaction and well-being in the aftermath, while 80% said that the experience fundamentally altered their perception of reality. Wow.
Yeah, I mean it's amazing. It is completely amazing. The use of psychedelics has come so far. Of course, this is 1 year old. The trial is well underway, if not concluded by now. I'm going to try and find out some more information on this for our next show and see if I can do some follow up on it. According to a small pharma CEO, Peter Rands, DMT delivers a psychedelic experience in 20 minutes and has unique properties that lend itself to clinical use. By adopting responsible evidence-based research and development into psychedelic medicine, we hope to rebrand these once stigmatized compounds as highly effective medicinal therapies, which can be integrated into current healthcare systems and made accessible to the millions of people who are seeking treatment. Bringing us back in. That's fantastic. Just fantastic. Really good stuff there. Great
Yes,
article to look
absolutely.
back on and see where we've come a year later.
Yeah, I
Yeah,
find
absolutely.
I enjoy reporting on the cannabis news, but I find a lot of this psychedelic news, I feel almost emotionally connected with it. Does that make sense, Kim?
Yes, it does. It does. You know, when you've gotten the help from these elements that we have, there is this almost spiritual connection to it.
Absolutely.
The same thing happened with me with cannabis in the very beginning. You know, of course, when I found out all of the medicinal properties in cannabis and what it could do for me and how it got me off of all of those heavy pharmaceuticals, and created a sense of homeostasis for me. It was I had to scream it from the rooftops. I had to tell everybody I knew. And this is following much the same path. Absolutely.
Absolutely.
Absolutely. Our
Oh my
next
God.
story is coming to us from Castanet. Castanet,
Ooh,
magic
yes.
shrooms in the South. In the South.
In the South. Yes, Way to Grow Biofarm Corp was given the green light from Health Canada to build psilocybin production facility, allowing them to produce psychedelics as well as propagate, cultivate, harvest, and sell psychedelics to pharmacies, clinics, and other licensed research facilities for allowable research purposes. Their new building will be on the same property located in Osio's Industrial Park that houses the business cannabis operations, which launched back in 2018. Yeah, so this is really exciting. They're going to grow psilocybin.
They're going to grow psilocybin in Canada. Good old Canada. Um, their new building will be on the same property in the Osoyoos Industrial Park that houses businesses cannabis operations, which launched in 2018. I had a hell of a name with this town's name. Had a hell of a time with this town's name on the Reefer Reporters back in 2018,
you,
reporting on the opening of the cannabis
you
warehouse
did
and the
better than
cannabis
me.
grow there, and now they're back and they're back and they're back and now they're in magic mushrooms. Plans are for the engineering and the drafting of the building design to be completed through the month of December and then move into construction in January. Only in BC can you do construction in January. Hoping to complete the building by the end of February, according to the company's CEO, Jamie Filipuzzi.
I'm glad you
Filipuzzi?
got that. I'm glad you
Filipuzzi.
got that name.
Philip.
Yeah.
Oh, I got all the good ones in that sentence, didn't I? Your turn.
It's, it's mostly at the start going to be used for research. There's only a few doctors right now that are working on it with patients. He explained there are 15 doctors, I believe, in Canada that are allowed to work with it, but solely on themselves while they figure it out before it goes out to patients and then hospitals. Since the company got its start with research focused on cannabis and extraction, along with medical sales, the CEO explained that it seemed natural to move into magic mushrooms as their expertise focused on cultivation science and the plant science. We're more focused on the plant science and development of fungi and cannabis. Yeah.
Yeah. Yeah,
Yeah.
and we're seeing that everywhere. They say in the responses from everybody that wants to try it, to be able to microdose. We've heard that we're seeing the interest. Absolutely. We cover so much of this on Psychedelic Tuesdays here on the Pace Radio Network. Philip also commented that there really hasn't been a problem with stigmatization of the hallucinogens locally. I think that we've been fairly welcomed, he said, and we haven't had any pushback from anybody or the government. Everybody's very eager to help and to move this new industry kind of ahead down in the Oyosos area. Oh, I screwed that up for sure. But
That's great.
but yeah, there it is. It's over in BC, southern end of BC. All these names, they
Even when you messed
kill
it up,
me.
you still did better than I did the first time. So I still give you total thumbs up.
Oh my goodness. Oh my goodness. Yeah, there's some good ones in there, that's for sure. Our next story is coming to us from Big Think. Are near-death experiences just psychedelic trips? I don't know, Cindy. What do you think?
Wow. Wow. There are possibilities there from what I have been learning the past while. For many people, the thought of dying fills them with dread and trepidation. What will it feel like? Will I be scared? Does everything just go black? Some of these fears are being looked at through emerging science, and it suggests that the elderly dying brain often grants us a comfortable demise, and it does it through dreaming. Accounts across history describe meaningful dreams and visions that arrive at the closing of one's life. All too often, these experiences are brushed aside as byproducts of brain-added delirium or side effects of medication. But in 2014, researchers at DeMen College and at Hospice Buffalo asked 63 patients admitted to the hospice care over a period of 18 months for their perspectives on any dreams or visions that they might be having. Participants described most of them as a source of personal comfort. In their dreams, hospice patients reported being in the presence of a deceased loved one, preparing themselves for a long journey, or seeing dead spouses, siblings, or parents waiting for them. Yeah.
Wow. Yeah. So is this a psychedelic experience? Is it a near-death experience? Is a near-death experience similar to a psychedelic experience, so much so that it can happen simultaneously? Who knows? But for those people, followers out there that are in the IWK network, chime in if you've got a response to that question while you're having your 420 West Coast toke. Happy 420 West Coast. Following the dreams of twilight life are more vivid ones that could arrive at the moment of death itself. Science points to our final moments being quite mentally sensorial finale. For starters, there are the accounts of people who have been to the brink of death and back. Many of them report having wild visions, which have been termed near-death experiences. Philosophers and psychiatrists, Raymond Moody, coined the phrase almost half a century ago that discovered a new common element of NDEs. A bright light, a sense of detachment from the body, feelings of security and warmth, and encounters of mystical beings. To religious people, this experience might seem like being welcome to the afterlife. To non-religious people, it might just seem they just seem to enjoy the trip. Interesting.
Yeah. Wow. Likening NDEs to trips is actually a responsible comparison. A high-cited 2018 study provided participants with low doses of the hallucinogenic drug DMT in a controlled setting, and then asked them to describe their experience. Their descriptions were uncannily similar to collected descriptions of NDEs. We are now learning that there is a good reason for that. It turns out that DMT is widely present in the mammalian brain. In 2019, researchers in the University of Michigan not only found the compound in various locations in rat brains, but they also discovered neurons in the two enzymes required to make it. Moreover, the neurons seem to produce DMT at levels comparable to those of other key neurotransmitters like dopamine, which drives pleasure, and serotonin, which stabilizes mood. Cool.
Absolutely. Absolutely. I mean, our body produces many of these elements that are now being looked at scientifically for medication that have in recent past been frowned upon. Our body makes DMT in the brain. We make iboga in our liver. We make cannabinoids in our breast milk. These things are happening naturally in the body, so it stands to reason that it would be comparable experiences with near-death experiences, mimicking or being very similar to that of somebody that is ingesting DMT for either medical purposes, spiritual purposes, or just a trip.
Mm-hmm. Absolutely.
Absolutely. Absolutely.
Absolutely.
Very interesting
Wow.
stuff.
Very cool.
Yeah, very interesting stuff. Great article there. I'm going to bring us back in. Great article
Okay.
there. I encourage people to go and have a look at it for sure. Near-death experiences mimicking DMT. Well, why is that? Well, it's because it's not really a mimic after all. It's a flat-out equal comparison because we're producing the DMT in our own brains. So there you have it. Science advancing our understanding of these natural therapies that are out there. Very cool stuff
Absolutely.
indeed.
Yeah, it's really neat.
Very,
Very neat.
yeah, very neat. Our next one story is coming to us from the Psy Post. Study suggests psychedelics promote positive health, mental health, through increased spirituality and emotional regulation. Ooh,
Yeah. Ooh, look at the pretty picture. Absolutely.
pretty picture.
Pretty picture. I love pretty pictures. A new study published in the Journal of Humanistic Psychology sheds light on the mechanism connecting psychedelic use to improve mental health. The study found evidence of a pathway whereby the use of psychedelics increases spirituality and in turn leads to better emotional regulation. This improved emotion regulation then appears to reduce symptoms of depression, anxiety, and disordered eating, which is actually that's another one that I never even thought about until I just read it. Like these can help with eating disorders.
Yeah.
Wow. Yeah, psychedelic drugs
Absolutely.
like
Absolutely.
psilocybin and ayahuasca, which we know is in part DMT, have been used in spiritual ceremonies for thousands of years in non-Western cultures. More recently, psychedelics have captured the attention of Westerners and scientific interest, in the medicinal effects of these drugs has resurfaced. While studies have begun to uncover therapeutic effects, the mechanism behind those effects remains largely a mystery.
Largely a mystery. Study. We've always got anecdotal reports as well that we can throw in there that are plentiful. Study authors Adele LaFrance and her colleagues say that increased spirituality, improvements in emotion regulation have been revealed as the key side effects of psychedelic use. The researchers propose that the use of psychedelics may be connected to a positive mental health through increased spiritual connection, which then facilitates emotion regulation. Well, no shit, Sherlock. Ha! LaFrance and her team distributed a questionnaire among 159 psychedelic users between the ages of 18 and 69. The participants reported their lifetime psychedelic use and related their spirituality. They also completed measures of emotion regulation difficulties, depression, anxiety, and disordered eating. Wow, the results are
Yeah.
in, and they're huge.
Yeah, the vast majority, 96% of participants reported using psilocybin in the past, and a third, 33% of them, of participants reported having used more than one type of psychedelic. Using regression analysis, the researchers found that participants with the more frequent psychedelic use reported greater spirituality, and those with greater spirituality had fewer difficulties with emotion regulation. They also found that participants were with more difficulties regulating their emotions had higher depression, anxiety, and disordered eating scores. In other words, participants with fewer emotion regulation difficulties had better mental health. Finally, a meditation model revealed that psychedelic use was indirectly related to depression, anxiety, and disordered eating through spirituality and emotion regulation. The study authors say that their findings add to the existing evidence. I like how they put that, add to the existing evidence that psychedelics offer therapeutic benefits. However, the study was cross-sectional, making it impossible to infer causality between variables. It just means that they need a little bit more. They needed what do they call them? The other group to bounce off of, like the placebo group.
They needed a control group.
Control group. That's the word that wasn't
they
coming in my
needed a
brain.
control
Thank
group.
you. Yeah. So the
Yeah,
researcher
you're
suggests that the
welcome.
longitudinal and experimental control trials should be conducted to replicate their findings and help establish causality. The further point to need study more diverse samples and increase the representation of all races, since psychedelics originated from those communities.
Yeah, absolutely. Absolutely. I mean, more study, more study, more study, but their findings did conclude a focus on spirituality appears to be a powerful catalyst for the transformation of emotional processing difficulties, which are thought to be underlying most emotion-based disorders, including mood, anxiety, as well as eating disorders that are so many out there. Absolutely, so many out there. Yeah, yeah. It's just it's a great article, and I hope that people go out and read it. Connection with oneself is over. It can be overwhelming for sure.
Yeah,
Yeah, for
absolutely.
sure. Yeah, yeah, for sure. Absolutely. We've got, I think, one more. Is there one left? 1, 2,
I
3,
think so.
4,
Yeah.
5. Yeah, we got one more.
If I keep
One
clicking the
more.
right buttons, I'll get there a lot faster, I'm sure. Here we go. I'm on the way now. Here we go.
On our way, on our way. One more story coming at you before medication time. We'll take a medication session after this next story that Bufo has picked out for us. This one's coming to us, oh my goodness, from the CBC. What's this now?
Very cool. Yes. Will
Yeah,
psychedelics
yeah.
become mainstream? This Calgary company is betting on it.
Yeah, well, I'm gonna bet with the Calgary company. How about you? Let's check this out. This looks very, very cool. Like the molecule pictures there. It's awesome. And Danny Matika discovered his love for chemistry when he was high on LSD back in the mid 2000s. The single tab of blotter acid, emblazoned with images of tongues from the rock band Kiss, sent him on a path to push psychedelics out of the shadows.
Nice. Nice. He's now 31 and he is the CEO of Cygen, a Calgary business hoping to manufacture synthetic psychedelics for the pharmaceutical industry. While the application of hallucinogens in medicine is in its infancy and remains highly speculative, him and his company are believers and are encouraged by renewed interest in the field. There's a huge market opportunity here, he says. And a spat of early scientific research, along with big injections of cash from wealthy and celebrity investors, has triggered a renaissance of sorts for psychedelics, which for decades were pushed underground by the war on drugs.
Yeah, as everything was, There's huge market opportunity here, a spate of early scientific research along with big injections of cash is what you just read. I'm lost. Sorry about that. Dozens of companies have emerged in recent years seeking to get in on the ground floor of the fledgling industry. They bet it will take them higher. Oh, I bet you there's pun intended there. Some like Germany-based Atai Life Sciences and the UK's company Pathways have become unicorns. Not some kind of hallucination, but the type that startups are worth more than $1 billion on the scene right now. Wow. Wow, $1 billion. We were hearing these numbers a couple of years back when everybody was scratching to get in on the cannabis scene as well, pre-legalization. We're seeing the same repetition happening, but a much faster pace with psychedelics.
Yep, we sure. It's taking right off. I mean, like it's in part because cannabis has paved the road ahead of it. And in another part, people are done. And again, the cannabis paving the road. People are done being quiet, so they're speaking up and they're telling people what mushrooms or iboga or ayahuasca or DMT has done for them, and other people are listening, and it's making a huge difference. Yeah. He says we're really breaking ground here. in the psychedelic chemistry, in that psychedelic chemistry has been illegal, and now we're able to do it in a legal context. Says, oh, giddy, I get one. Peter van der Heijden, Psygen's co-founder and chief science officer. That was really actually quite easy. I'm doing okay with that one. It's never been done before. Absolutely. There's a potential for a new industry. Magic mushrooms, LSD, and other psychedelics are hallucinogenic drugs that, remain illegal to possess for recreational use, unless somebody wins in the Supreme Court. But some regulators, such as Health Canada, have allowed for research into them as possible treatments for mental health conditions, sending companies and investors on a trip to the new industry.
Yeah, I love the play on words in these articles. While the sector initially attracted an early rush of investors' enthusiasm, some of the euphoria has already begun to fade as shareholders come to grips with the long and uncertain road ahead. Oh, we heard the same spiel with cannabis, just the people with itchy fingers and no patience to wait pull out early. Our researchers are still running clinical trials looking into whether substances like psilocybin, active ingredient in magic mushrooms, can effectively and safely treat depression or whether MDMA, often found in ecstasy or Molly, can help patients with post-traumatic stress disorder. Well, I mean, maybe if you newspapers stop, putting the commonalities together with things like Molly and ecstasy, then we'd move along a little bit faster even yet.
Yeah.
We have to go through the entire drug approval pathway to demonstrate safety and demonstrate efficacy, according to van der Heijden. So it's early, really, to say how these things will work out. Well, I'm going to predict it's going to work out all right, just watching the enormous stream of people that are jumping on the natural therapy bandwagon.
Absolutely. I'm with you 100%. It's going to go places. Since I've been involved with psychedelics, like this time around, right? As a medicine intentionally, not anything I've done before that, but, it's
right.
And speaking of that and having the people around me that are, used to be 100% against all this stuff, and now they're singing the praises to their friends. If they can be convinced by just watching how things are going, I think everybody's going to see it, and it's going to do spectacular things. It absolutely. Production is expected by early 2022. Psygen's lab, currently under construction, would initially manufacture psychedelics for research and clinical trials, though it still needs Health Canada approval. The company hopes those trials lead to the creation of new therapeutic drugs, allowing its lab to expand commercial scale production of medical grade substances. They've asked Health Canada for a dealer's license, which gives special permission to handle and produce controlled drugs that are otherwise illegal to possess. The designation comes with a strict set of rules, including security measures to prevent theft, proper record keeping, and reporting.
Yeah, I'm going to skip right down to marijuana paves the way for mushrooms because, I've been saying this. I hate the fact that the CBC is still using the word marijuana. But other than that, I've been saying this for over a year now. Since we started all these shows in the psychedelic front. Cannabis really did pave the way for all other natural therapies to have a much easier path to acceptance and legalization or decriminalization. The Alberta business has applied to handle 8 different psychedelic drugs. Though its CEO said that psilocybin is the substance most in demand from the drug development companies, likely because of loosening cannabis laws. And that is absolutely true. You skip down one more time for hungry for something new, and the industry observers say that legalization of cannabis for recreational or strictly medical purposes in many parts of the world has helped to ease stigmas and convince investors to pump hundreds of millions of dollars now into psychedelics.
Mm-hmm.
And that is so true.
Absolutely.
That is so true. This is a very, very lengthy article. We cannot possibly cover it all. I'll let you pick out the final paragraph.
Well, Joe Jitzel, isn't that terrible? Steve Hawkins, the CEO of financial services company, runs a fund that allows people to invest in the broader psychedelics market. And so far, it's individual investors. So I'm skipping a couple of paragraphs here, rather than big pension funds that have parked money in the fund. So instead of going into their pension funds, instead of taking their money and putting it into pension funds, they're going into psychedelics. But we're still at a very early stage. Investors are hooked on psychedelic ventures. Investors hooked on psychedelic ventures also face plenty of risk, and they do. It's absolutely terrifying, and I think it's really exciting. We're going to go so far with psychedelics and help so many people.
Yeah, bringing us back. Yeah, absolutely. I mean, it's an exciting time on the psychedelic frontier. Businesses are geared up to dive in. Investors are geared up to dive in. And, Health Canada and other regulatory bodies around the globe in other countries are now looking at this with a serious eye. And we owe a lot to cannabis for paving the way and making it a much easier road to travel for the next ones that are coming up, like psilocybin. And with that, it is medication time.
Time to pay the bills. Stay tuned from a word from some of our sponsors. Then we'll return with another 5 news stories that Bufo has chosen, making mainstream media today.
Yeah, we'll be back in about 5 minutes. So hang on and listen to a word from our sponsors.
The opinions of the individuals during this broadcast are their own and may not be the opinions of their group or other
Open your eyes.
Next week on Psychedelic Tuesdays, tune in at 7 p.m. Eastern for Open Your Eye, our 90-minute video podcast with Kim Cooper and me, Cindy Howell, where we sit down with patients.
Open your eyes.
Next week on Psychedelic Tuesdays, tune in at 7 p.m. Eastern for Open Your Eye, our 90-minute video podcast with Kim Cooper and me, Cindy Howell, where we sit down with patients, facilitators, lawyers, and others in the space to discuss their experiences and endeavors working with psychedelic medicine. Join us on Psychedelic Tuesdays each week at 7 p.m. Eastern for all of your news and information from the world of psychedelic medicine.
You're listening to the Pace Radio Network, here at paceradio.net.
At Legacy 420, we believe in being different.
Experience the difference of quality control.
Our labs provide tested formulations for all of our products.
Experience the difference in trust.
Our customers can trust that we are following up-to-date COVID precautions for their safety.
Experience the difference in accessibility.
We're open 7 days a week. Please visit our website, legacy420.com, or contact us for curbside pickup as well as nationwide mail order shipping.
Legacy 420 values overall wellness.
Come and experience the difference of Legacy 420.
The Pace Radio Network is the place to be for all your information from the world of psychedelics, because we are pleased to bring our listeners 2 shows focusing on psychedelic therapy in the world of natural medicine. First up, we have Open Your Eye, which airs on the 2nd and 4th Tuesday of each month. Open Your Eye is a 90-minute video podcast with Kim Cooper and Cindy Howell interviewing patients and professionals in the space. Patient stories, facilitators, lawyers, and others discuss their journeys and endeavors involving psychedelic medicine. But they're not done, because Kim and Cindy are back on alternate Tuesdays at 7 p.m. with Psychedelic Reporters as they bring along the show's mascot, Bufo, aka the Colorado Mud Toad, who is scouring the news wires for all the latest in psychedelic news. He then passes it on to Kim and Cindy to cover in this 60-minute video news podcast. So tune in every Tuesday at 7 p.m. Eastern for Psychedelic Tuesdays right here on the Pace Radio Network, found at paceradio.net.
Enjoy the buzz of legalization with Campbellford Lifestyle Shop. From lights to plant nutrients, books, consumption accessories, and more, we've got all your basics to grow or consume cannabis. Visit our info center or take a look at our piercing services and body jewelry, now available in-store through Campbellford Lifestyle Shop, 17 Bridge Street West, Campbellford.
What do you find at paceradio.net? People advocating cannabis education.
A doctor's job is to relieve your pains. And when it comes to growing cannabis, the biggest pain is trimming. Let Dr. Buck Cannabis Trimming Solutions take the pain away. Whether you're a home grower or a commercial operation, we have the cure. From 4 plants to 400 plants, garden size doesn't matter. Dr. Buck Cannabis Trimming Solutions comes to you with years of experience and professional discreet service. It's simple. We trim your weed and we do a damn good job. Visit drbuckcts.com to book your trimming.
CP operates a medicinal cannabis signing clinic. If you want to grow your own medicinal cannabis and are located anywhere in Canada, then I'd like to suggest that you give them a call. They can be reached at 1-613-967-9888. That's 1-613-967-9888, and grow on with CP.
Growing your own vegetables, flowers, or even medicinal plants can be a challenge without the right equipment and proper know-how. At BMA Hydroponics, not only are they your urban horticultural experts and suppliers, but their staff holds the customer's needs paramount to making a sale. Family-owned with decades of experience and knowledge, they offer free advice in person, by phone, or email. BMA Hydroponics wants to ensure you have the advice you need, which is why you'll find tips and tricks on different ways to grow, like wick, ebb and flow, drip, or aeroponic system, as well as other helpful links at bmahydroponics.com. If you can't find what you're looking for, just let them know, and they'll do everything they can to get what you're looking for. At BMA Hydroponics, each staff member also possesses a federal exemptee MMAR license, making their strong suit empathy, experience, and dedication to their customers. Because when you know how to grow, you'll have results that make you proud. BMA Hydroponics in Belleville, Ontario. Visit bmahydroponics.com.
Bufo here, your psychedelic reporter, here on paceradio.net.
And we are back from our medication session live here at the Psychedelic Reporters on paceradio.net.
And we got another 5 stories coming at you here this evening, given to us from the one and only Bufo Alverius. So let's get right at it, Cindy. What's our next one here that we got?
We are heading from MSN. MSN. Psychedelic medicine, 5-MeO-DMT formula for treatment-resistant depression has positive trial results.
Positive trial results again. Wow, what a shocker. Clinical stage biopharmaceutical company GH Research, PLC, announced positive results from recent clinical trials of its leading 5-MeO-DMT formula, a therapy candidate for patients suffering for the treatment of resistant depression, or TRD. The Ireland-based company, Ireland's in on the scene, which this year announced a capital raise of $315 million, is focused exclusively on research around the psychoactive molecule 5-MeO-DMT to treat depression, a condition that affects many millions of people around the globe. Currently, an estimated 50% of patients receiving therapy for TRD did not respond to approved depression medications. Wow.
Yeah, I feel that. 100%. The lack of effective treatments for TRD has created a market for companies like GA Research seeking to develop such therapies, potentially changing the way TRD is treated today. So far, GH Research is on track to validate claims that their proprietary GH001 5-MeO-DMT formula is safe and could provide relief from TRD with no serious adverse adverse effects for patients. Completing 2 phase 1 healthy volunteer clinical trials and phase 1 of 2 clinical trial in patients with TRD, studies have so far revealed that 87.5% of patients were brought into an ultra rapid remission after an individualized single-day dosing regime using GH's research's inhalable 5-MeO DMT product. Wow.
87.5% with one treatment. Again, I ask this every single week. Why is this last resort? Why do we wait until like nothing else works? They're not treatable with anything else. Okay, give them this, the surefire thing. Why aren't we going here first? It's just, it's mind-boggling. Fast action is the key, they say. Part of what makes the substance valuable for clinicians treating depression is the drug's potency, fast-acting nature, with onset occurring within seconds, and treatment lasting an average, respectively, of about 15 to 20 minutes. Shorter duration psychedelic treatments will likely scale better than other psychedelic treatments, such as therapy using psilocybin or MDMA, they say, which can require 5 to 8 hours from clinicians involved in administering and monitoring patients. So yeah, it is a much longer treatment when you're using these other things. The inhalable versions of many of these elements are very short-lived, and they come up with some amazing results.
Yeah. Biopharmaceutical companies are keenly aware of creating therapies that require less time and fewer clinician hours in the hopes of health insurance providers covering treatments, as in the case with ketamine treatments. Another key action of 5-MeO DMT is its ability to produce ego loss or ego death during an experience using the drug, which can produce valuable insights that change one's overall perception of life and its difficulties. Oh, yeah, does it ever? Making news headlines over the last month was heavyweight fighter Mike Tyson's endorsement of the substance as a positive catalyst that transformed his life. I died during my first trip, Tyson says. In my trips, I've seen that death is beautiful. Life and death both have to be beautiful, but death has a bad rap.
Yep. Yeah. And it's true. I mean, we all walk the same path. We're born, we live, we die. That is the definition of life. Found of course naturally in small quantities in some plants. 5-MeO DMT is most noticeably found in higher concentration in the dried venom of the Bufo Alverius toad, also known as the Soran desert toad or the Colorado mudslinger, and the amphibian's defense secretions have been the source of mounting exploration in the psychedelic underground since the 1980s. Oh, I think before that, people have been licking toads since the Western days.
Long time.
Long time people been licking the toad. Yeah, for sure. The substance has made its way over the past decade into labs like GH Research, with the mounting use of synthetic forms of 5-MeO DMT employed to study potential therapies for TRD. Why does it got to be synthetic? Why don't you just use the real thing? Why do we have to recreate everything that's already here?
Yeah. I think part of it too is accessibility. Like, there's only so many toad frogs, and you can only milk them or take their secretions. I don't know exactly what they harvest them or whatever it is. So much. So I think part of it might be that it's. I know a lot of vegans prefer the synthetic. I don't know.
Yeah,
reasons that
I can understand that. I guess.
Yeah.
I get that.
Yeah, maybe.
Yeah. Personal reasons, I guess. Yeah. Okay. There's a place for everything, I think.
One important study in 2019, which garnered interest in the drug and its use for depression, showed that participants who experienced high levels of ego dissolution or oceanic boundlessness during their session displayed higher ratings of satisfaction with life and lower ratings of depression and stress. GH Research has plans to request an initial investigation new drug IND meeting with the FDA in the first quarter of 2022. This is reported Green Market Report. An IND approval from the FDA would provide the drug maker authority to proceed to the next stage of trials if the experimental drugs are showing, I'm going to change that to medicine, if the experimental medicine are showing promise in clinical testing for serious or immediate life-threatening conditions while the final clinical work is conducted and the FDA review takes place. Wow. They're taking 5-MeO DMT to the FDA, Kim.
Yeah, it's going to the FDA. Well, I don't want to get into the FDA. But yeah, it is the first step for clinical trials and for new medicines coming on the market. Is absolutely the first step. It is it's very exciting stuff to see this kind of stuff happen, advancement happening on the corporate level, because that's what it's going to take for us to advance this as a medicine, for sure.
Oh yeah,
That's what it's going to take.
my mind's blown. My eyes are sparkling with excitement. I can mean like FDA, jumping in, but man, let's make this shit legal. Come on, FDA, this is awesome.
Yeah.
I'm really excited.
Yeah.
I think a little.
Yeah, that's the first step.
Yeah.
Yeah, it is absolutely the first step. So it's exciting to see these companies, garnering some acceptance by the scientific community and people taking a good serious look at more natural therapies that are available out there to treat these things. But still, why is it last? Why? But we'll get there. We'll get there. I just got to push that bus up the hill.
There's more and more of us every day pushing with you. So we'll get there.
We will get there. We will get there. Our next story, magic mushroom psilocybin edges towards mainstream therapy. Oh, look at those pretty shrooms.
Aren't they beautiful? Yeah, they're very nice. Tony Head was depressed and fearing death from stage 4 prostate cancer when, as part of a supervised scientific trial, he took a large dose of the psychedelic agent in magic mushrooms, psilocybin. Head donned a mask and headphones to shut out the world around him and had an experience that changed the course of his life.
Yeah, and it's not the first time that we have heard this. At some point in the time, I felt like a higher power or something. I didn't see anything. I didn't see any type of image. I felt like something connected and touched me. And as soon as it did, I started crying. Head, an award-winning nominated actor who lives in New York City, said in an interview with Health Day Now. He said the one-time therapy helped relieve much of the anxiety surrounding his prognosis. I think it taught me how to live better and not to worry about dying, he said. I was blown away by what had just happened. It's unimaginable experience, at least it was for me, he added. It's something that can't be explained, but I can tell you it's probably one of the most important things that ever happened to me. Amazing.
Absolutely. Yeah, I am so emotionally connected to these stories. They just give me chills. Psychedelic therapy focused on psilocybin has garnered much new interest lately as a potential treatment against anxiety, depression, and other mental ills. In fact, the fungi is now legal for mental health treatment in Oregon, a result of ballot initiative. The recent release of Hulu's Ministry's 9 Perfect Strangers has also focused fresh attention to the concept of microdosing psilocybin as a means of therapy. I haven't watched that yet, and I got to get on it. Yeah, there's
Yeah.
a long history. It's a field that founded in the 1960s as a psychedelic drug became associated with the left-wing counterculture, explained Dr. Charles Grob, a professor of clinical psychiatry and biobehavioral sciences with the UCLA School of Medicine. Yeah. However, prior to that, psychedelics like
Wow.
psilocybin, had shown great promise in mental health research. He also told Health Daily Now.
Yeah, yeah. I mean, there was a big uptick after counterculture sort of grabbed hold of them. I mean, they were at Woodstock. Don't eat the brown acid, man. And it was the counterculture really grabbed hold of the use of psychedelics because they were freeing and they opened the mind to new possibilities. And that generation really embraced that type of a lifestyle. And that's kind of where everything got halted on the research end because now it was labeled a drug for the counterculture. And that's very sad that we had that mindset back then, or we would be further advanced now, that's for sure. In the 1950s and the 60s, there was a period of time when psychedelics were really considered cutting edge. And something's going on with my computer. That's not good. I'm going to let you take it away. I'm going to mute for a second.
Okay. In the 50s and 60s, as Kim said, there was a period of time when psychedelics were really considered the cutting edge of psychiatric research. And there was tremendous enthusiasm, Grob said. There were reports of patient populations who did not respond well to conventional treatments that did very well. Even Hollywood leading man Cary Grant turned to psychedelics during that early period. The actor took LSD as many as 100 times under the care of a Beverly Hills doctor, according to the documentary Becoming Cary Grant. So that's.
I would love to see Cary Grant on acid.
Yeah, wouldn't that be cool?
I would love to see Cary Grant on acid.
Absolutely. Absolutely. Yeah. So I mean, like they were studying it all back in the 50s and 60s, and of course, and then we all, people discovered, hey, this can be fun at Woodstock or on at the party and whatnot, and the powers that be got scared.
Yeah, in comes demonization. It's another, again, a lot of these psychedelic articles are very, very lengthy. No way we can cover the entire thing. I encourage everybody to go on our site and grab hold of the article and read it for yourself. Cary Grant having experiences back in the 50s with Hollywood doctors. I mean, then it hits Woodstock. We don't eat the brown acid and everything goes to shit. And now here we are in 2021 and we're back on the train of learning, and acceptance is gaining ground. I'm going to go to recalibrating the mind. Just how do psychedelics work their magic on the brain? Well, according to Grob, psilocybin and its pharmaceutical cousins profoundly alter our state of consciousness by acting on certain receptors in the brain. We also know that circuitry of the brain is briefly modified and in a sense goes offline and creates more of a resting state, Grob said. It's almost as if the brain for a period of time goes offline and then recalibrates in an enhanced state. How beautiful is that?
It's gorgeous. Yeah, absolutely. Wow. That just, like, I mean, like he's got some really great words here. I absolutely agree with him. I mean, that's what a reset is. Like if you think about what you do to your computer, you take, or your phone, you take the battery out, you let it rest, you let it reset, you put it all back together, you take it right offline, you put it all back together and let it build back up. And that's what we're doing to our spirits and our minds when this happens.
Yep, absolutely. You're having a computer problem and you call the computer technician. The first thing they do is tell you, shut it down. Do a reboot. Let's see what that does. And I mean, that's the first thing we do. And our brain are largely a computer. So, I mean, it stands to reason that this is where we would be right now. I'm going to skip down one more time to more study needed, because that seems to be the conclusion of every article we read. Psilocybin has garnered more interest in modern research and therapy than LSD because of the few advantages over the more powerful psychedelic. Psilocybin trips tend to be shorter lived than an LSD trip, and it can extend as long as 6 or 7 hours. The trip also tends to be easier to guide, more visionary, and less likely to create anxiety, paranoia in the patient. Interesting.
Absolutely.
I guess that
Yeah,
depends on who you are.
that's
Yeah.
true. And some people, I have seen it
Yeah.
cause anxiety, but on a much lower scale than LSD. So
Absolutely. I know a few people, not many. It is rare. I will say that. I'm going to bring us back in the subset on the bottom. It is rare, but I have seen instances with certain patients that it's the complete opposite. The flip happens. Everything that's supposed to bad happen with LSD is what happens to them with mushrooms, and LSD is the comforting trip. So, I mean, that just goes to show you that we are really all wired very, very differently. I know we refer to cannabis a lot, but I'm going to go back to it again. It's the same thing with cannabis and strain related. What works for one will not work for all, because we are all wired very differently.
yes, absolutely. Absolutely.
Yeah.
I had that conversation with somebody else the other day too about different psychedelics and what they do, and they said, "I can't believe that this one didn't work for you." And I'm like, "Well, we are all different." So it wasn't MDMA for me.
Yeah.
It was something else, and it's true, right? Like not everything is going to work for everybody.
That's right. That's right. That's exactly right. And the world of psychedelics is the same thing. Well, hell, the world of pharmaceuticals is the same thing. When you go to the doctor and you get on that pharmaceutical train, how many different antidepressants do you go through? And they say, oh, well, we're going to try this one and see what this one does for a month. And, oh, that one's no good. Let's try this other one. And you wind up, with this list. You could go through, literally, dozens and dozens of brands of pills over a very short period of time until you find the right one. Absolutely. Absolutely. Our next story is coming to us from Toronto and CTV News.
Yeah.
CTV, more mainstream.
Yes, what I was about to say, another mainstream. This is really exciting. Toronto Health Board votes in favor of application to decriminalize drug possession. What?
Yay, Toronto. It was on the table and it looks like it's going through. Absolutely. Toronto Board of Health has voted unanimously to ask the federal government to decriminalize possession of small amounts of illegal drugs in the city. Wow, unanimous vote. At a meeting Monday, the board requested that the city's top doctor submit an application to Health Canada for an exemption under the Controlled and Drugs and Substances Act by the end of the year. So this is weeks away.
Yeah, it's the latest step in the city's effort to combat the opioid overdose crisis. A recent report from Toronto's medical officer of health, Dr. Eileen de Villa, said there were 531 opiate toxicity deaths in the city last year, an 81% increase from 2019. That's very sad. De Villa has said the increase is due to multiple factors, including an unregulated drug supply, as well as pandemic-related service reductions, which is, it's cut back on everything. The city hosted consultations and engaged with stakeholders on the decriminalization issue between August and November. And now they're moving forward.
Yeah. Now they're moving forward. Of course, Vancouver made the same request for decriminalization to Health Canada early this year. Both those cities are following the Portugal model that, of course, happened many years ago and is having great success over in Portugal. I'm bringing us back in. and it's having great success over in the Portuguese model for sure. Absolutely. It's exciting times for the city of Toronto. They're on it.
It is.
They're on it. They're
Yeah,
moving
no, that's really
along. They're moving
fantastic.
along with us. Oh, I think I just killed the wrong story. I think I just killed the story. I killed my next story. I have to get it back. I have to get it back.
You've done that.
Where am I? Where am I? Where am I? History. There it is. There it is. I'm getting it back. Our next story coming at us is a really interesting one. And of course, this is the one I killed. How could I do that? The rise of psychedelic retreats. We've had somebody with a psychedelic retreat on our show recently. This is very
cool. A couple of them actually. Different types of retreats. Yeah. One night in 2019, while strangers vomited around her, Lynn Cohen had a vision. And you have to know a little bit about ayahuasca to know how, relaxing that is for some people, having a bunch of strangers vomit around them. After being tipped off by a friend, Miss Cohen, who was 62, traveled from her home in Milwaukee to Chicago to drink ayahuasca, a sludgy psychoactive brew from the Amazon that ignites hallucinations while inducing nausea. Yay! She arrived carrying her own pillow, her own blanket, at a private house where she was greeted by a shaman. In the living room, she curled up on a sleeping mat, and over the course of that one very intense night, went on a journey that mostly involved lying still.
Yeah. Very cool stuff. I'm sorry, I'm having some audio problems now.
Okay.
My computer was skipping out. Internet problems up here in the north. But yeah, no, this is. I mean, it is so reminiscent of a past guest that we've had on Open Your Eye, who talked about doing exactly this in her home. I mean, she blankets up all the windows. Everything is locked down. The people come over, the shaman comes over, and they have these ceremonies. So reading this story, that's all I could think about was this particular person. I don't want to name them just in case, but but yeah, I mean, this is exactly what she explained to us that takes place in her home. And of course, we know of retreats where people go and they do this at a retreat as well. So I mean, this is very cool that people are doing this. And the vomiting part, it may sound nasty to most people, me included. When I first heard it, I kind of gasped. But now understanding it more, it's not quite as traumatic for me to hear about it. If you go in there with a fairly clean system, if you go in there and you've done prep work for a month before, just as we would for anything else running a marathon, you prep for some time, you do some training, then a lot of that can be mitigated over the course of your prep work. So it wouldn't be quite as bad. Absolutely. There are steps that can be taken. Psychedelic retreats in countries like Costa Rica and Jamaica, where many psychedelic substances are allowed, as well as among the shadow network of shamans in the United States and Canada, I will add, who share drugs and details over social networks, are experiencing widespread growth. Their rise overlaps with an increasing popularity of cannabis tourism during the pandemic. Well, imagine that.
Absolutely. And all of the people that we know that work in psychedelics and run some of these healing retreats, they all sport cannabis. They all share cannabis. They all use cannabis as a medicine. So they are on the playing field of plant medicine and natural psychedelic medicine. So it all really goes hand in hand. It's just another plant, right? Psychedelic drugs are quietly gaining steam thanks to growing interest among some mental health professionals who see them as a novel therapeutic for depression and post-traumatic stress disorder. That interest is now being wrapped into the global wellness industry, which, spurred by the coronavirus pandemic and the increased mental fragility that has come with it, is set to reach a $1.2 trillion by 2027, according to a report by Global Industry Analysis. Before I read the next paragraph, let's go back to that number, 1.2
I'm
trillion.
skipping it. Yeah.
Yeah. There is extraordinary.
Yeah. We're going to skip a lot of the next few paragraphs too.
Okay.
Yeah, because this is a huge, long article. All of them, every single one. There's no short articles on psychedelics. They don't exist. They're all books. So I'm going to skip down to Dr. Ronald Griffith. He's a professor at Johns Hopkins University of Medicine and the founding director of Hopkins Center for Psychedelic and Consciousness Research. And he says the entire cultural conversation around psychedelics has changed. And that's concerning to him because he thinks they underestimate the risks involved. I think that's a doctor being overreactive. We heard the same thing come out with the cannabis movement as well. Doctors saying, oh, no, it's cannabis, you're smoking it, it can't be medicine. And yet, the proof is in the pudding with all of the literally millions of patients that have now been helped with cannabis. So I think it takes clinicians, doctors of psychiatry specifically, and especially those that work for have vested interests in big pharma and that kind of thing. It takes them a little longer to come around, I think. What do you think?
Yeah, I was really lucky, as we know. I unfortunately lost you in this article, but that's okay. I was very lucky, as you know. I came across a psychiatrist to treat me that was extremely open-minded, but she's one in a million. I really do believe. Not everybody is as lucky as I have been with finding somebody who's open to it. Most doctors and psychiatrists are still sitting back and looking at it. Although I will say that they're looking at it a lot closer, faster than they did with cannabis.
Absolutely. Sort of to my point is the very final two paragraphs in this article down at the very bottom. Dr. Griffith of Johns Hopkins said, while he does welcome the erasure of a decades-old stigma around psychedelics, he also urges travelers, because this is about travelers retreats, he also urges travelers to ensure that any psychedelic experience is done under the care of vetted medical team with proper screening and oversight. Absolutely. But, I guess it all depends on your definition of a medical team. Because a medical team can also consist of, a practical nurse and a shaman is your medical team, along with your religious guide or your spiritual guide. It could be your medical team. And I think so in that sense, I agree with him. So, but it's slow moving in the world of mainstream medicine in places like Johns Hopkins. They are studying it, but they are doing so cautiously.
Yes.
Without trying to encourage, I guess.
Yes. Yeah, absolutely. They by all means support psychedelics. He said, being Dr. Reef, I think they're fascinating, but these are medicines, not recreational drugs. They're powerful medicines.
We know that. Anybody I'm going to bring us back in on the bottom there. They are very powerful medicines. And I think, there was a time that when we used these, we were using these recreationally. But, as with cannabis, was it solely recreational? We gravitated towards that space for a reason, right?
Yeah.
And your body generally knows what you need. We wouldn't have been there if there wasn't a medical need for it in the first place. So I've said this, cannabis again, but it's so true. The parallels are just naturally there. Um, all use is medicinal because it doesn't matter what your reasons are. If you're getting medicinal benefit, then it's medicinal.
Yeah.
Right?
Yeah, absolutely. Absolutely. 100%.
Yeah.
Yeah.
Yeah. We've got one more story. I know we're long in the tooth tonight. Very long show tonight. All these articles are so damn long. They're great info though, so we've got to cover them. Microdosing on psychedelics has risen thanks to COVID. If it's not happening, if it's happening, people need a safe environment, they say. Well, we're going to make safe environments.
Yes. Yes. And we've been screaming this for cannabis ever since. Like we all need safe lounges to go consume at, because a lot of places don't allow it, et cetera, et cetera. So again, another comparison. We've heard this with cannabis. The COVID pandemic has not only battered people physically, it has taken a toll on the mental health of millions.
Absolutely.
Anyone trying to seek counseling or other forms of support will know how difficult this is, with waiting lists running into months, not weeks. With some things years. Little surprise then that people have found their own solutions to improving how they feel and think. The Global Drug Survey, as the name suggests, an international probe into drug use by people from a range of countries, including the UK. This year's results have just been published and highlight the way people have used drugs during the pandemic. One of the most fascinating findings is that recreational drugs users have moved to microdosing psychedelic drugs like LSD and magic mushrooms to mitigate poor mental health. While a normal dose of LSD might be 100 micrograms, microdosing typically involves taking just a tenth of this amount in a single dose.
Yeah, it might seem counterintuitive for someone who already has problems with their mental health to be taking a psychoactive drug in an attempt to improve how they feel. However, the experience of these respondents mirrors the growth scientific interest in this class of drugs as potential treatment for mental health conditions like depression and anxiety. Treatment, although research isn't conclusive, it does show these drugs have some promise, albeit combined with specialist therapy. Coming back in. Excellent short article, getting to the point. COVID has caused an increase and people gravitating towards this space. And it stands to reason that would happen in this particular age right now that we're in. With so much mental health issues, of course, more are gravitating to this space.
Yeah, it's not shocking at all.
Yeah, it's not shocking at all. And that's 10 articles from the one and only Mr. Bufo Alverius, choosing them out for us this week. We got her done. Long articles as always.
It is what it is. Psychedelics, there's just so much to talk about.
Absolutely. There sure is. And that's the end of our show. I don't have my notes up because I was having some computer issues. So I will say in closing, thank you for joining us here on the Psychedelic Reporters here on paceradio.net, and for tuning into our video podcast here on the Pace Radio Network, also broadcasted on YouTube pages and our social media platforms.
Yes. We hope that you enjoyed our update on mainstream media coverage of psychedelic medicine advancements from around the globe. Thanks to Bufo talking in our ears.
Yeah, absolutely. Many thanks to our sponsors and to Mike, of course, to my lovely, joint host, Miss Cindy Howell, joining me here each and every single week on Psychedelic Tuesdays here on the Pace Radio Network. And let's hear one more time from our boys in Dead Ringer for our closing this week with our brand new closing material and opening material. Dead Ringer from Kirkland Lake. Thanks for tuning in, everybody, and we'll see you next week for Open Your Eye.
Good night.
The opinions of the individuals during this broadcast are their own and may not be the opinions of their group or other organizations they may be involved with.
You're listening to the Pace Radio Network here at paceradio.net.
Looking at myself, reflections of my mind. It's just the kind of day to leave myself behind. So gently swaying through the fairyland of love. If you'll just come with me, you'll see the beauty of Tuesday evening news.
BMA Hydroponics has everything you need to succeed. Visit our hydroponics superstore at 404 Maitland Drive in Belleville and we'll show you how to grow your own quality cannabis for pennies per gram. We're open Mondays, Tuesdays, Wednesdays, and Saturdays from 10 a.m. to 5 p.m. and Thursdays and Fridays from 10 a.m. to 7 p.m. Call 613-967-9888. BMA Hydroponics. It's worth the drive. The only way to go.
CP operates a medicinal cannabis signing clinic. If you want to grow your own medicinal cannabis and are located anywhere in Canada, then I'd like to suggest that you give them a call. They can be reached at 1-613-967-9888. That's 1-613-967-9888 and grow on with CP. The Pace Radio Network is the place to be for all your information from the world of psychedelics because we are pleased to bring our listeners 2 shows focusing on psychedelic therapy in the world of natural medicine. First up, we have Open Your Eye, which airs on the 2nd and 4th Tuesday of each month. Open Your Eye is a 90-minute video podcast with Kim Cooper and Cindy Howell interviewing patients and professionals in the space. Patient stories, facilitators, lawyers, and others discuss their journeys and endeavors involving psychedelic medicine. But they're not done, because Kim and Cindy are back on alternate Tuesdays at 7 p.m. with Psychedelic Reporters as they bring along the show's mascot, Bufo, aka the Colorado Mud Toad, who is scouring the news wires for all the latest in psychedelic news. He then passes it on to Kim and Cindy to cover in this 60-minute video news podcast. So tune in every Tuesday at 7 p.m. Eastern for Psychedelic Tuesdays right here on the Pace Radio Network, found at paceradio.net.
A doctor's job is to relieve your pains. And when it comes to growing cannabis, the biggest pain is trimming. Let Dr. Buck Cannabis Trimming Solutions take the pain away. Whether you're a home grower or a commercial operation, we have the cure. From 4 plants to 400 plants, garden size doesn't matter. Dr. Buck Cannabis Trimming Solutions comes to you with years of experience and professional discreet service. It's simple. We trim your weed and we do a damn good job. Visit drbuckcts.com to book your trimming.
Enjoy the buzz of legalization with Campbellford Lifestyle Shop. From lights to plant nutrients, books, consumption accessories, and more. We've got all your basics to grow or consume cannabis. Visit our info center or take a look at our piercing services and body jewelry, now available in-store through Campbellford Lifestyle Shop. 17 Bridge Street West, Campbellford.
Did you know that the Pace Radio Network isn't just a radio network? That's right, because most, but not all of our programming is now done via video and is then podcasted at paceradio.net. So if you want to watch our programming, you'll find us on the Pace Radio Network's Facebook page, plus the show's own page, and you'll find us live on the network's YouTube channel. And don't forget, you can find it all, video and audio, at paceradio.net.
At Legacy 420, we believe in being different.
Experience the difference of quality control.
Our labs provide tested formulations for all of our products.
Experience the difference in trust.
Our customers can trust that we are following up-to-date COVID precautions for their safety.
Experience the difference in accessibility.
We're open 7 days a week. Please visit our website, legacy420.com, or contact us for curbside pickup as well as nationwide mail order shipping.
Legacy 420 values overall wellness.
Come and experience the difference of Legacy 420.
You're listening to the Pace Radio Network here at paceradio.net.
Open your eyes.
Next week on Psychedelic Tuesdays, tune in at 7 p.m. Eastern for Open Your Eye, our 90-minute video podcast with Kim Cooper and me, Cindy Howell, where we sit down with patients, facilitators, lawyers, and others in the space to discuss their experiences and endeavors working with psychedelic medicine. Join us on Psychedelic Tuesdays each week at 7 p.m. Eastern for all of your news and information from the world of psychedelic medicine.